So tonight we're going to look at fibrocystic breast disease and breast cancer, the two major breast disorders. My disclaimer is that this is simply educational material. This is not meant to diagnose or treat any human. Please do that only under the care of a qualified, licensed healthcare practitioner. Starting off with fibrocystic breast disease. What are fibrocystic breast disease? Well, it's a bunch of lumpy, bumpy, tender cysts in the breasts. About 20 to 40% of women have those, of adult menstruating women. Especially worse during your PMS period. Women tend to complain about more breast tenderness and swelling before their menstrual period. It's often thought to be related to an increased ratio of estrogen to progesterones. So too much estrogen and not enough progesterone. It often runs in families. It's, of course, tender and painful. Interestingly, it's worse if you have less than 3 bowel movements per week. Why is that? Because we poop out our estrogens. That's how we get rid of estrogens. And if you have sluggish bowels, your colon reabsorbs your estrogens and you get higher estrogen levels. So it's good to eat lots of fiber and have frequent bowel movements. We prefer people to have bowel movements 2 or 3 times a day rather than 2 or 3 times a week, which is unfortunately common in America. Fibrocystic breast disease is made worse with coffee consumption and any caffeine, but coffee seems particularly bad. Even drinking decaf coffee can make FBD worse. And it leads to scarring and excessive biopsies because to a mammogram, fibrocystic breasts look an awful lot like cancerous breasts. So they often can't tell the difference, and women get a lot of unnecessary breast biopsies due to the fibrocystic breast disease. We think another very common cause of this is iodine deficiency. There's a great discrepancy about how we think about iodine when we look at conventional medicine versus integrative or alternative medicine. Basically, conventional medicine is very fearful of iodine these days. Although 50 or 60 years ago, iodine was a very common therapeutic used in medicine. So how do we treat fibrocystic breast disease? Well, we want to avoid caffeine, especially coffee. And interestingly, you can get your caffeine from organic green tea, and that can actually help your fibrocystic breast disease. We want to identify and treat subclinical hypothyroidism. How do you know if you have subclinical hypothyroidism? What this means is that your thyroid labs are basically normal, but your body temperatures are low. So we have you take your temperatures in the middle of the day, between 11 a.m. and 3 p.m., with a real thermometer under your tongue. And if your temperatures are consistently less than 98.0, then probably your thyroid's not working just right. And we can do things to help your thyroid work right. Conventional medicine doctors basically believe that if your lab test is normal, then your thyroid is working normal, but we look a little bit deeper than that. We can check your iodine status by simply painting iodine onto your, move that forward, by simply painting iodine onto your skin. So onto your forearm or your belly, we get an iodine tincture and paint it on there. And interestingly, if the iodine disappears quickly, then your body's very thirsty for it, and you're more likely to be deficient. If the iodine stain lasts a long time, then you have enough iodine in your body. You don't need more.
So cool.
It's so cool, and it's very simple. And along with that, vitamin B6 in the activated form called P5P, or pyridoxal 5-phosphate. Regular B6 you can actually overdose on and can end up causing neuropathy if you take too much of it, but P5P you can never overdose on and works a lot better than just plain B6. Magnesium and B6 work together for your production of neurotransmitters. They work together for your ovaries, and they work together to help your breasts utilize your progesterone better to decrease the fibrocystic breast disease. And then ground flax seeds. And ground flax seeds have actually at least 3 different ways that it helps decrease fibrocystic breast disease. One is it has lots of fiber, so it binds up estrogen in your colon and you get rid of more estrogen, so it lowers your estrogen. Secondly, it has lignans, and lignans change the way that your estrogen is metabolized downstream. Lignans help you go into a more favorable estrogen that decreases the risk of breast cancer, which we'll talk about a little bit later. And the third way is that they have essential fatty acids. They have the same types of essential fatty acids that are in fish, the types that most Americans are deficient in. And when we're deficient in these essential fatty acids, we get more inflammation throughout our bodies, whether that's arthritis or inflammation in the breasts. So taking ground flax seeds helps in numerous ways. And then if you still, after all that, if you still have problems with lumpy, bumpy, tender breasts, and especially before the menstrual period, you can put castor oil onto your breasts. And you can take that and just rub it in like a massage oil, and it'll go right through the skin into the lymphatics. It clears toxins out of the lymphatics so that your breast can drain all that extra fluid and bogginess out.